Got it. It's live now.
Yeah, okay, perfect. So thank you very much, ladies and gentlemen. This is Vikram Rajput, your host today, founder and CEO of Subhag Health Tech. On behalf of Shaktya Consulate General of India, Hamburg, and Morarji Desai Institute of Yoga, and Dr. Mishra Academy. I welcome you all. Today we are celebrating our International Yoga Day, which is about to come on 21st. And this time we thought to connect the yoga to a very a taboo problem, which is the infertility, since the yoga is able to solve many of the problems. So we wanted to have the opinions of key experts, what they have to say about yoga and how it can be used for the infertility treatment. Today we are having, we are blessed to have Honorable Consulate General of India, Mr. John H. Rolungul sir here with us. Along with him, we have blessing to have a Dr. Ishwar Basavareddi ji, who is a director of Morarji Desai National Institute of Yoga, New Delhi. Along with him, we have Dr. Richa Sharma, senior fertility consultant and IVF expert. And we have a Dr. Nidhi. She is also a gynecologist and infertility IVF consultant. And along with that, we also have Dr. Rajesh Mishra ji, who is expert in the yoga. So thank you very much for taking the time out and considering to participate in this function where we celebrate the yoga. At the same time, we also touch base with some of the key problem of the infertility. So having said that, I would kindly ask Honorable Consulate General of India to bless us with some few words so that we can kickstart the program. Sir, please.
Okay, yeah. Thank you very much. And namaste and good evening, Dr. Rajesh Mishra, President of Shaktya, and distinguished speakers and participants, especially Dr. Nidhi Jha, Dr. Richa Sharma, and everybody who is here this evening. You know, last year we celebrated International Day of Yoga under the shadow of the COVID pandemic. And I remember the program organized by Dr. Mishra and Shaktya in Brugger Park in Bremen, which my wife and I attended. And also there was an online seminar on yoga and dance, where the eminent panelists included the world famous Indian classical dancer, Dr. Sonal Mansingh, MP, and many others. This year, after more than 2 years of the COVID, and as the restrictions are being lifted across the world, and things are slowly coming back to normal, I look forward to celebrating the 8th International Day of Yoga on a bigger scale. Here in Hamburg, as you can see behind me, you know, even as we are celebrating the 75th anniversary of our independence, and as part of the Azadi Ka Amrit Mahotsav, we'll be celebrating International Day of Yoga on the 21st of June in front of the Rathaus, which is the most iconic place in Hamburg. And I take this opportunity to invite all participants and everybody to come and celebrate the day with us. We are collaborating with several established yoga institutions in Germany, including Shaktya, and we are very excited and looking forward to a few hundred participants on the day. And the location is in the center of Hamburg, which normally sees hundreds of tourists and passers-by, and we really look forward to showcasing yoga and Indian culture to the public as a whole. So today's event is the first yoga-related event that I'm attending this year as a run-up to the International Day of Yoga. I'm very happy to be part of the event, and I thank Dr. Mishra for giving me this opportunity to be here. You know, some people see yoga as India's gift to the world, and I have also heard others jokingly call it the most popular export. But the fact is that yoga is a shared heritage of entire humankind. It is an ancient wisdom with contemporary relevance. In the present fast-paced lifestyle that we are living in today, it has become increasingly popular as a path to wellness and fitness. It is not just the stretching and the exercises, but also the breathing, the relaxation, as well as meditation, concentration and centering of the mind and spirit. It reduces stress and anxiety as well as aches and pains, and protects us from lifestyle diseases while improving our general health and performance and the enjoyment of our daily lives. For the individual, it provides equanimity and also equilibrium. And we all know that a person at peace with himself or herself is at peace with the world. So yoga is the ancient Indian art and science of healthy living. It provides a holistic approach to well-being, to physical, mental, and spiritual well-being, which is why I look forward to our panelists, what our expert panelists have to say on today's theme, which is also very interesting, that is yoga and infertility. So I will not take much time, and I will conclude my remarks and once again express my sincere appreciation to Shaktya Bremen for organizing this program, and also to the panelists and the participants which are present here today. Thank you very much. Namaskar.
Thank you very much, sir. Thank you very much for your kind word. As we mentioned that, unfortunately, Dr. Ishwarji is not physically present here, but he has definitely sent us a note in the form of video. We'll play his video that would take 10 to 15 minutes time, and thereafter we'll proceed further with the event. So let me just share his note.
Om Shanti Shanti Shanti. His Excellency Consulate General of India, Hamburg, Mr. John Longwood, Dr. Paridhi Jain, Dr. Nidhi Jain, Dr. Rajesh Mishra ji, all eminent speakers, dignitaries, yoga enthusiasts, and my brothers and sisters, my pranams to you all. It's my to just convey the greetings from Government of India, Ministry of Ayush, and Morarji Desai, National Institute of Yoga, on the occasion of your countdown program leading to 8th International Day of Yoga, going to be held on 21st of June 2022. On my own behalf, it's a very happy occasion to share that the whole world is joining with us to celebrate the festival of yoga for health and well-being. It's not a mere International Day of Yoga, it has taken the shape of a festival. So this is very special for the Indians this time, since India is celebrating 75th years of its independence. We call it is in India Azadi Ka Amrit Mahotsav. So the IDY activity in India has also been considered as one of the activities of the 75th years of independence. The second one is we are doing this one to represent the cultural and heritage sites across the globe, not only in India. So wherever the cultural sites and heritage sites, iconic sites, so we're doing yoga and bringing this heritage sites into the limelight, because yoga is cultural heritage. So Honorable Prime Minister Shri Narendra Modi ji would like to mention that these heritage should come along with the practice of yoga. Then third most important aspect is yoga for humanity. This year theme is yoga for humanity. Human values are the integral part of our yoga practice, especially the yamas and niyamas, which are the prerequisites for every practice. So lay foundations, or they are the quality control for the entire practice of yoga. So that's why the humanitarian value to bring all sections of the society under one platform and practice yoga together. It may be any person, any caste, any region, any country, and even deprived society, people from deprived society. So all together we are practicing yoga for health and well-being entire population of the world. Therefore, how this has been started? So many years ago, the Indian yoga masters traveled across the globe, promoted the philosophical and cultural values of yoga to the entire world, and the world is looking towards India for the many solutions which are in the public domain. So yoga has the solutions for the body, yoga has the solutions for the mind, yoga has the solutions for the spirit. It has a message for the spirit. So these important three dimensions, the body, mind and the spirit, has been taken shape in the declaration of International Day of Yoga on 14 December 2014. So then onwards, it's an history, and it is the 8th edition. Worldwide, it is being celebrated in a festival mood, irrespective of countries, caste, caste or religion. All of us are accepting yoga, doing yoga, and this is the effort of the entire global community. So this is led by none other than the Honorable Prime Minister of India, Shri Narendra Modi ji. Himself is a yogi, practice yoga regularly, but whenever you go anywhere, he promotes, because he knows the value of yoga, which brings the working energy. There are 5 dimensions of yoga. The first dimension is whenever we do something, we need the physical fitness. The physical fitness, you do half an hour yoga, it keeps your spine flexible and the brain functions optimum. The metabolism, the inception, digestion, absorption, circulation and elimination processes, part of metabolic activities, and they improve by the regular practice of yoga. The second one is once it happened, we can eat well, then sleep well. We are suffering from the sleep disorder, sleep well. Then it comes to the work well. We want to work with happiness. Yoga helps us to work well. These are the simple benefits what we have. Eat well, sleep well, work well. Every human being, every animal being would like to have this. Once it is achieved, so that will be a feeling of happiness. If it is quantified, it will convert into a peace. So that's why in our IDY logo, we mention yoga for harmony and peace. So harmony, it is within the micro level, within the cell, between the cell and cells and tissues, and entire human being, and in the family, in the workplace, at the workplace, and at the society at the global level. This enhanced harmony bring the total peace, and that is the need of the hour. So in the pandemic conditions of these things and the war type situations in many parts of the world, the solution is yoga, because yoga brings entire humanity under one platform. So this message on this eve of International Day of Yoga, we want to send across the people, across the globe, in all continents, so that the tense situation, especially in the Europe, can be reduced. This is the one way out. And another dimension today they have mentioned about is the infertility. And you all know that there is a primary infertility and secondary infertility. The primary infertility diagnosed when a couple has not conceived after 12 months of trial. And secondary infertility diagnosed when a couple fails to get pregnant again after having children. So many people, the first one, primary infertility, it may continue for a long time. Infertility affects up to 15% of the couples trying to conceive. It might be caused by female or male factors or both sometimes. With prompt treatment, most couples do successfully conceive and healthy babies. So many times this gives a lot of tension, especially to the women population. So 10 to 15% of married couples affected by the infertility. 27.5 million couples suffered from the infertility, especially in India. 40 to 50% attribute to the female factor, 30 to 40% affect to the male factor. So what are the reasons for infertility? So one is unhealthy eating habits, older couples, stress, and many other factors, and PCOS and PCOD. Therefore, the unhealthy habits, they are smoking, alcohol, unhealthy lifestyle, medical reasons, and using too much of contraceptions, etc. They will also lead to infertility factors. Regular and systematic yogic practices promote the physical as well as mental health, as I said, and has great effect in promotion of health. And also it promotes reproductive health in male and female population. How does yoga help in treating infertility? Specific yoga postures increase blood supply to the reproductive organs like ovaries, uterus and testes. As more nutrients are supplied, the vitality of these organs are maximized. Yoga fertility poses improve hormonal level in both and female especially. Yoga stimulate ovulation and also increases the sperm counts by regular practice of pranayama and some of the postures, especially the Shirshasana, Sarvangasana, Viparit Karni, Uddiyana, etc. are very helpful. It helps to in overweight women or those having flabby muscles to tone up the muscles and increase flexibility. Yoga practices have been shown to slow down the aging process of eggs and the sperms, eggs in the woman and sperm in the male. So yoga practitioners also improve their diet and lifestyle, which significantly increase the chance of conception. Regularizing the menstrual cycle is one of the key factors. So we can see regular practice of what I said, few asanas will help to improve the regular menstrual cycle, which is very important in conceiving. Significantly improves pregnancy tests in women undergoing rigorous of infertility treatment. The practice of meditation or relaxation helps to reduce the stress level, the cortisol level, the stress hormone level have been reduced in the who are practicing yoga nidra and meditation. So the regular yoga practice can also increase the couple performance, sexual performance. So once we got the satisfaction in the sexual intercourse, that will definitely increase the chances of fertility. Couples, yoga helps in the couples increase emotional connections and intimacy development. What are the topmost 5 postures? One is Bhadrasana, especially for the women. So then it goes to the Bhujangasana.
Should I
Sarala
continue with the
Bhujangasana, Purna
fertility part?
Bhujangasana. Then Ardha Halasana, Sarvangasana, Setubandhasana, Pavana Muktasana. So what I said, particularly if we can do Nauli or Kapal Bhati and Nadi Shodhana Pranayama, Dhyana are very, very important in improving, reducing the stress and also improving the fertility rate. I recommend particularly for women the Sarvangasana followed by Matsyasana. For men, Shirshasana followed by Shavasana, and go for the 15 to 20 times alternative nostril breathing or followed by Brahmari Pranayama. Definitely we have a higher rates. Very few studies has been conducted regarding the efficacy of yoga in increasing the fertility. There are some studies, but still there is a lot of work to be done because especially in India, it's a very sensitive matter. So many people are hesitant to disclose many of their personal problems. That's why conducting research is a challenge, especially in India, on the efficacy of yoga in the infertility, treatment of infertility. So with this, today the international seminar is on the topic health, healing and also efficacy of yoga and treating infertility. Just few remarks I made. I do hope that the entire deliberations today will throw new light on the various dimensions of yoga in the health, healing and especially treating infertility. So I congratulate Dr. Rajesh Mishra ji, and this time he has taken many initiatives, and always the Consulate General of India at Hamburg, and they are very active, and every year I am participating in their seminars and their IDY celebrations. This year also they are taking a very leading initiative, and I do know that May 27th after. So every weekend you are all practicing yoga, promoting this one of the most simplest form of keeping healthy, and that is the service for the entire mankind. With these few words, I once again congratulate all of you and convey the best wishes and greetings on the eve of International Day of Yoga 2022. Jai Hind, Jai Bharat. Om Shanti Shanti Shanti. Om.
You are on mute. Unmute, please.
Yes. We would like to thanks Dr. Ishwar ji for kind note in his busy schedule. With that, let's move to the next step. May I, Dr. Nidhi, are you constrained by your time right now? Did I hear you right?
Yes, I was I had time constraint.
Okay,
Sorry.
okay, no problem. So maybe Dr. Nidhi, we can start with you and then we can jump to the Dr. Richa. So let me just invite Dr. Nidhi for her sharing her insights from many years of practice as an infertility consultant and IVF expert. Dr. Nidhi.
Yeah. Good evening, everyone. Yoga has not been new to all of us, but our Prime Minister Narendra Modi ji has given it a different face, and I can say that he has tried to push yoga to international level in a very fruitful way. So we all should feel obliged to him for that. And when we talk of yoga in infertility, as the previous speaker said, that most of the around 50% of the cases are involving both male and female, 25% from the male, 25% from the female. So yes, in these, as all of us know, that India has become the diabetic capital of diabetic capital. In the same way, it has become capital of in field of PCOS, obesity. In all the fields, the number of patients are increasing. PCOS, people think that it is a disorder for hormonal imbalance, obesity, and other hormonal issues. But I always feel that stress is also a very important contributing factor. So here we talk about the meditation part of yoga. In my practice, and basically I feel even in India, the northern part is more suffered from diabetes and PCO. Diabetes and PCO, when we compare, why I'm talking again and again about diabetes, because the pathophysiology of both the diseases are same. Insulin resistance. So whenever we talk about insulin resistance, exercise, meditation, and yoga has a very important role in decreasing the resistance of insulin. So that is the main physiology behind PCOS. Yoga has two forms. Basically, one is exercise and one is meditation. Exercise part is dealt by many other modalities like aerobics, gymming, running, swimming. There are many other things, but meditation part, I think, makes it more unique, and it's very useful for our patients. When we are talking about other things like there are some exercises, some asanas in yoga which specifically improve blood supply from around uterus and ovaries. That also contributes in increasing the fertility rate. There is one disease called endometriosis. This I didn't know earlier, and now I have been in fitness since quite some years, and I have been in touch with yoga instructors. So there are even asanas who improve pain and infertility in patients of endometriosis. So there are many aspects where we can deal with yoga, and we have seen good outcomes. Any specific questions?
Yes, so Dr. Nidhi, there are some very basic questions what we keep on hearing from the infertile couples, right? And most of the time it's essentially female are blamed that they have the problem, but as you suggested, and also the data shows that 50 to 60% are male driven. So the very basic question what everyone wants to know is that what is the age when someone should be alarmed that they are not able to conceive and they should look and treat themselves by yoga or by any other medicine? What should be that trigger age limit?
Sir, there is no specific age defined when we should start treating infertility or looking after infertility. As by the previous speaker, it was said fertility is defined when 12 years of unprotected intercourse is there and the person is not getting pregnant, the female is not getting pregnant. So 1 year is at least the time when you should try, and then if you are not becoming pregnant, you should go to a fertility expert. But now in this era, when the age of marriage is getting higher, we even ask our patients, even ask the general population to contact your doctor if you have not conceived in within 6 months of your if you have planned 6 months back and trying since 6 months, still not getting pregnant, you should consult your doctor. So there is no age specified, but yes, in females, if you are more than more than 35, then definitely you should meet your fertility expert. First of all, I would always advise that whatever exercise, whatever, if you are talking pertaining to fertility, please consult your doctor first, and accordingly you can plan whatever you want to do. What yoga, if it is concerned with yoga or exercise, that the expert only will suggest, yoga expert like you people are. But yes, you should consult your doctor if your age is more than 35 and you have been married for more than 1 year. You should consult the doctor and start. But about lifestyle changes, what we say, or what we should say, it is not age dependent. It should be a part of your life. There is no age for yoga. Yoga should be started from childhood, I feel. But some point of exercise, like when we are young, when we are in our teens or in early 20s, our basal metabolic rate is high. So we generally do not tend to deposit fat so easily. Late 20s or early 30s are the time that when I feel that it's compulsory that everybody should do some kind of exercise, either be it yoga. Why it is better than any other form of exercise? Because it also involves mind. Meditation is also involved. And one thing I'm very concerned about all the health freaks, that sleeping is very, very important. We have seen cases where you are a regular yoga expert or regular gym trainer or regular marathon runner. Sleep deprivation is very, very important. बहुत बार ऐसा होता है, just to for exercise or yoga or for something, we get up early every day, we sleep and we get up early. That also in the modern times I have seen that cardiac failures and other cardiac features have increased because of sleep deprivation. So whatever kind of exercise you are doing, please complete your 6 to 8 hours of sleep. That is very, very important.
How the chances of pregnancy looks like when the woman, if they have the PCOD or PCOS? So how does it look like? They can still be conceiving naturally? Is it possible?
Yes, it is possible. Earlier, when PCOS, first of all, I must say that whenever a girl or young women hears of PCOS, they should not be scared that they will not get pregnant. PCOS is a very common syndrome these days, and it is even seen in 20 to 30% of the population. So it is a very common thing. It is nothing rare. So there's one more thing very, very important, that sometimes we have young girls coming with the ultrasound findings. Ultrasound says that you are PCOS, and they are very depressed that the ultrasound is saying that we are PCOS. So I would like to make it clear that only ultrasound finding of PCOS will not make you PCOS. There should be some clinical symptoms, some menstrual irregularities, some androgenic features like facial hairs, sudden weight gain, baldness, and androgenic hair loss. That also should be there with the ultrasound finding. So and most of it in initial days, the very first thing we advise to our PCOS patients is lifestyle modification. The problem with PCOS is that the girl or the woman is not ovulating. So when we tell them to decrease their weight by 5%, only 5% of weight reduction in a given span of time will make you ovulatory from anovulating. You will start ovulating. So yes, it is possible only by lifestyle modification to get pregnant, but not in all the cases.
I would actually also ask Dr. Mishra ji here because he is the yoga teacher for many years. Mishra ji, tell us that if yoga they have some special yoga asana or meditation which can make the cycles, period cycles regular, or they can make unovulity to the ovulatory woman. Is it possible?
See, where we are in Germany, so you cannot commit or cannot say that that will be done by anything, because as is law. But yes, definitely, I can say here that the health wise will be the fine,
Mhm,
because it's there is many practice which stimulates. For example, simple is yogic breathing. Yogic breathing is you breathing in through the stomach and breathing out through the stomach. So you are stimulating your all internal abdominal organ.
mhm,
You are activating. At the same time, you are making strengthening. And it's not only the physical aspect, but it's also the mental aspect. Because when you do the rhythmic breathing, your mind getting relaxed. Because when someone is under stress, two major parts affected. One is face, second is abdomen,
mhm,
right? And of course, there is a lot of practices people can do. But the simple thing is yogic breathing. And of
mhm,
course, people can contact their local yoga experts. They can understand the individuals and they can suggest something. But yes, definitely, the yoga practices will be um, helpful for the quality of life in case of the infertility and PCOS.
mhm. Okay. So, conscious of the time, thank you very much, Dr. Nidhi and Dr. Mishra ji. Let's move to Dr. Richa Sharma's presentation, and thereafter we can create an open house to discuss some common factors. So, Dr. Richa, uh, yeah, Dr. Richa, you are muted. I don't hear you. Do you?
Hello, am I
Yes.
audible? Yeah.
Yes.
So नमस्कार सबको मेरी तरफ से. My name is Dr. Richa Sharma. So thanks to the organizers for giving me the opportunity, and thanks especially to the audience जो अपना time share करके हमें सुनने के लिए आए हैं. So we will start with the presentation. I think what you see, you can it will be easy for you to understand. And that's why it is in the presentation form. So the topic is yoga in infertility. We have to compare like yoga versus what is the comparison with the ART. So we can go for the next slide. So I owe all to my parents and Almighty, and definitely the journey called life. So to begin with, when we talk about the health, it is the holistic health. Holistic health का मतलब है कि like it is not only the physical, it is the like emotional well-being, your physical well-being, your spiritual. So it is a complete your mental health is very important, especially when we have gone through the pandemic phases and there was lot of crisis of all types. So obviously it is the overall health. So when we talk of overall health, so we have to see all the aspects. So that is the concept we have to see. So next slide. So when we talk about like how yoga can be compared with the ART. ART means assisted reproductive technology. That is the artificial ways of getting pregnant. So if we see the comparison, so we see that everything has a logic and a science behind it. So I think that is something कि we cannot compare it. ये चीज को हम comparison नहीं कर सकते because it is an ancient Indian practices which have been passed on by our ancestors, and we are lucky that we have the people who are expert in this and taking the legacy forward. So we see that ancient जो practices हैं इसमें yoga is one of that. So if we compare with the modern science, so what modern science can do, obviously we cannot expect from the other aspect. So everything has to be in a balanced approach. When the patient approaches us, obviously patient has the information, they are aware, they already have suffered a lot because infertility is a stressful condition. So they already have the homework done with them. So obviously when they ask us whether they can do yoga, what is the effect of yoga and other practices, so obviously seeing the patient profile, because each patient, each human being, like I generally say to the couples also, is unique. हर इंसान एक अपने आप में यूनिक है एंड हर किसी की समस्या भी डिफरेंट रहती है. सो एवरी profile is different, so it has to be individualized. So based on their profile we have to give the advice to the patient. So definitely when we go for the in-depth advices, we have to take the help of the experts, because definitely as infertility IVF specialist, we are not expert in the yoga, but definitely we definitely see the benefits in the overall health and certain other aspects which I think Dr. Ishwar and Dr. Rajesh had covered. So we'll go with the next slide. So when we talk about the ART it comprises of artificial means. It can be to begin with your TI, timed intercourse. It can be IUI, it can be IVF, and it can be the last resort, that is surrogacy. And the obviously the worst situation when patient has no option there to go for the adoption. So there are certain limitation factors are there. So but we see that age alone is not the reason. So we have to see that when a couple approaches us, what is the age of the couple. So if age is more, obviously that is a concern, but sometimes what happens, age may be less, and there may be family history or some genetic history that they have a tendency of premature ovarian failure is a condition. I'm just giving the example. Or suppose there is a male patient, he may have already been diagnosed with azoospermia as a condition. That means that sperms are not there, that is zero sperm. So in that case obviously we cannot keep on waiting for the age. So where the problems can happen, it can be at the level of egg, sperms, uterine cavity, or the fallopian tubes. So there can be certain medical contraindications to carry the pregnancy, genetic issues, and indications I have told you. It can be absolute or it can be relative. So obviously if we talk about whether one thing can replace the other, definitely answer is straight no. So they have to be collaborated and they have to be in a balanced approach. And for that, it should be like expert advice to be taken. Next slide. So if we see that fertility factors are one of the consequences of a fast and modern lifestyle. So fertility rates are affected by a wide range of medical, physical, psychological, and hormonal factors. So modification in lifestyles can help you for a stress-free conception and pregnancy. So as you know, next slide. Yoga is an ancient practice and its importance cannot be ignored in our life. So as already I think Dr. Ishwar had covered in his presentation, what are the benefits of yoga? It's in the next slide. So it improves the fertility potential in both male and female. So when we talk about the like what impact it has, whether it is direct or indirect, so it has definitely indirect effect is there, because when your body is healthy, your mind is healthy, you are stress free, you can think more clearly. So you can think in a better way, you can have a good relation, you can have a better like menstrual cycles are improved, and in cases like PCOD, and as such also if patient is undertaking any IVF treatment or IUI treatment, they should be relaxed as much as possible, because what we find that uh, it's everything is in the mind. If you think positive, then you definitely to more towards into the positive category. So if you are already stressed and you start in a negative note, and you have lot of ifs and buts, you are not sure about yourself because of multiple, because see we are human beings, हम इंसान है, तो obviously we are the stress हमसे कहीं दूर नहीं जाएगा. But instead of that we have to learn to live with that. Living with that doesn't mean that we have to force it, but we have to adopt certain practices, and yoga is one of that. So what we call medically, there is a term which is coming up, that is fertility yoga. So science behind, as already Dr. Ishwar had covered. So it helps to keep your muscles relaxed. It gives not only physical and but also mental strength. And I think everything, you have the mind which controls your body. अगर हमारा mind strong है, तो हमारी जो पूरी body है वो भी strong रहेगी. But definitely we have to adapt the certain changes to it. And if your muscles are strong and flexible, it helps in the easy delivery of the female patient. It detoxifies your body and decreases your stress levels, and it increases the blood supply to the pelvic organs, and blood supply, when it is improved, it helps to improve the chances of pregnancy. It's not about the natural pregnancy आप try कर रहे हैं, and even with the artificial means, even if you are trying like IUI, IVF, if your blood supply is good, so your chances of receptivity का मतलब है कि बच्चा पकड़ने की क्षमता जो है वो बढ़ती है. So obviously it is affecting the fertility potential of the couple indirectly. So it helps to maintain the hormonal balance, like in PCOD patient, as I already mentioned, because if you are exercising, you are having a healthy routine, so your belly fat will be controlled, your BMI will be controlled. So that is the bad fat, what we call. So when bad fat is decreased, so obviously your chances will increase and the balance is more maintained. Because ultimately सब जो है balance का ही हेर फेर है. So the ultimately couple, what they want, they definitely want that they should have a joyful journey and a smooth journey to the parenthood. So they will have that female will suffer less of complications because the body is more balanced. So next slide. I think yoga experts, they have the added a lot. So as infertility expert, I think let's talk about infertility, because patients have to understand the basics first. Ultimately what we want, so what we want when while planning pregnancy, we want a healthy egg, we want a healthy sperm, we want a healthy womb, that is uterine cavity, and we need to have healthy fallopian tubes, that is the they have to be patent. This we are talking when we are planning for the natural pregnancy. So अगर ये सब आपके पेटेंट है, हेल्दी सिचुएशन में है, then we expect the couple to conceive within short time after having the regular sexual intercourse. Next slide. So already has been explained that infertility means that patient is not, couple is not able to having pregnancy even after 12 months of unprotected intercourse. Means they are not using any condoms or taking any pills, that is unprotected. So it can be primary or secondary. So now the term is between infertility and subfertility and sterility. So infertility means that they have a difficulty. Subfertility means they had pregnancy or had conception earlier. So it can be further primary or secondary. Primary means without any previous conception, and secondary means they already had previous pregnancy, or maybe in the form of miscarriage, but they had carried once. So obviously if we compare, जैसे हमारे पास patients आते हैं between the primary and secondary, if we see the chances to have the pregnancy is more in case of secondary subfertility as compared to the primary. So this is just a picture presentation, simple presentation, how the egg and sperms, they try to fertilize. So to understand the basics, during intercourse, there are millions of sperms which travel through vagina, but only hundreds actually reach the egg, and only one egg has to meet the one sperm. And if more than two sperms meet the egg, then obviously that is an abnormality. So that is the nature. See, nature also has a check. So at every point our nature is so precise that there is a check that the baby born, nature tries कि जो बच्चा born होता है वो healthy हो. So these are the various checks. Okay. And ultimately that fertilized egg, if you can see in the picture, that fixes in the womb, that is the uterine cavity, and that is in the day 5. So those days we will discuss later. So next picture, next slide. So as you can see in the picture, we have the days of embryos. You can see that egg is being released from the ovary, then it is captured by the fallopian tube, and for that आपकी जो fallopian tube है, it has to be mobile and flexible, then only it can capture the egg. So ultimately it fertilizes with the sperm, which ascends upward through the vagina and the cervix. It has to be motile. So obviously there are certain criteria for both the egg, sperm, and the fallopian tube, and of course the uterine cavity. So ultimately after fertilization, it changes to 1 cell, 2 cell, 4 cell, then 8 cell, and ultimately it reaches the day 5 stage. And there are further stages also. So it is actually at the day 5 stage, which we called as a blastocyst stage, at which the embryo will get fixed. So overall, next slide. If we talk about the causes of infertility, I think it's a repetition. So we have the female factor, we have the male factor, and we have the combined and unexplained. So every segment has its own part, so we cannot like solely attribute कि ये male की वजह से है या female की वजह से है. Obviously case to case vary करता है. There can be situations where maybe there is evident female factor only or evident male factor only, but generally we see there is equal contribution. So in female, if we begin with, so it can be defect can be at the level of eggs, it can be at the level of fallopian tube, it can be at the level of uterine cavity, or it can be overall general or medical reasons can be there. So same way in males, that sperm is the main concern. Other than that, there can be sexual disorders and there can be unexplained reason. Unexplained means when there is no evident reason and nothing can be detected in the investigations, but still they are facing the issue of infertility and the combined factors. So this is the overall. When the patient comes, then we do certain investigations for the couple because we have to rule out that nothing is missed. Sorry. So in female, we do the test for the eggs by ultrasound, that is sonological investigations, then biochemical tests, certain blood tests are done, in which AMH is one of the most specific one, and the clinical history gives us the lead. And in male, it is mainly the semen parameters, and in certain cases where there's a derangement or absent sperms or some medical history is there, then we go for the hormonal profile. So next slide. Next. No, prior to that. So if we see treatment options can be divided, that's a hierarchy of treatment. So it can be TI. TI means timed intercourse, that we give patients some medicines to induce to grow the eggs. You can say in simple terms, or it can be natural also. And after that, once the ovulation is there or it's about to happen, then we tell the patient that these are the fertile days. So we are using the window period. That is the simplest way. So even when you are planning the pregnancy with lifestyle changes, this is the simplest way by which the doctors will advise you. If these things don't work or the indications are such, then the next step is IUI, that is intrauterine insemination. And the third option is IVF or ICSI. And the last option is surrogacy. Next slide. So IUI is intrauterine insemination, that is artificial insemination. And this what happens that the semen sperms are washed and they are injected into the uterine cavity of the female, that is the female partner, wife, and we have to see that it should collaborate with the timing of the ovulation. So we are facilitating the process, like it is just like what happens naturally and normally. Only thing is we are timing the things and facilitating it with the help of medicines and the trigger injections. Next slide. So this way covered. Next. So I think this already I have explained. Next. So as already again and again we are telling you that age is such a thing which won't wait, irrespective whichever treatment we do. So obviously we have to individualize the treatment. We cannot have a blanket therapy. Okay, आप आए हो तो अभी आप पहले TI से शुरू करो, आप लाइफस्टाइल करो, फिर आप IUI करो. We have to see कि couple की requirements क्या है. So based on the patient profile, we have to give the treatment plan to the patient. Because as the age will advance, the ovarian reserve will decline, and there is no medicine which can improve that. Next. So what is the next slide? What is the need of IVF? Means where IVF is indicated. So it is in case of, suppose if already couple has tried all kind of simple modes of treatment like TI, IUI, and that also cutoff is there. That also decided by the age of the couple. So like on an average, we can say that 3 to 4 cycles of IUI are undertaken if they are within reproductive age group, younger age group, and if they don't work, then we have to go for the IVF. So second reason is if they are blocked tubes. अगर आपकी fallopian tubes ही बंद है तो obviously उसमें natural का कोई scope नहीं है. You can go. You have two options. Either you get it open with laparoscopy if they are in a situation that they can be feasible and they can be of viable situation that they can have that function also of a healthy tube. So obviously then only it is of any benefit. If we see that tubes are in a situation that they are already damaged, or we have a frozen pelvis situation, we have TB patients, we have very severe endometriosis, और previous surgery और there adhesions are there, obviously उस केस में surgery का कोई use नहीं है, so obviously patient को individualize करना पड़ता है. Then we have male factor is there. Suppose there are no sperms and couple is not ready for the donor sperm, so obviously then they have to go for the IVF ICSI. An advanced stage and many such indications are there. So your doctor actually will decide, seeing your profile, which category means which treatment plan suits you. Next slide. So next slide, this is a flow chart. This describes ki when you go for the IVF, which steps are followed by the doctor. So what they will do, they will call you. There are two steps basically: pre-IVF cycle, treatment cycle, and the IVF cycle. So in pre-IVF treatment cycle, they will do the basic workup to see that you are medically fit to carry the pregnancy and how much success rate we can have. Because I think patient awareness is very important, because you should know that success rate which clinic is claiming or which books or articles are giving, that may not be matching you. So each patient is different. So based on those profiles and tests, doctor will tell you like for your case how much is the success rate. Your success rate cannot be compared with the other couple. So based on that, they will see the profile, and after that they will call you in the next cycle. So next cycle generally क्या होता है कि patient को day 2 या day 3 of periods we call, and we do the some basic tests and ultrasound is done, and after that they are given certain injections on daily basis. On an average 10 to 12 days it takes, and once the eggs are ready, then the eggs are taken out under anesthesia. आपको बेहोश करके अंडों को निकाला जाता है, and after that sperms and eggs are mixed and babies are formed. That is the embryo. That is the smallest form of the human. Okay. So after that, embryos are made to grow day 2, day 3, day 5. And once the embryos are formed, if you're fit to be for the fresh transfer, means in the same cycle, then those embryos are transferred. How many, which stage, that actually depending upon the clinic, depending upon the nation, depending on the law of land, and definitely most important, depending upon the patient profile and age, that decides. Next slide. So this picture depicts whatever I explained you. So first thing is, patient has a worry that there is a lot of pain in IVF. That is straightway answer no, because everything is under anesthesia except obviously injections and ultrasound will be without anesthesia. So it is a very simple procedure, but it should be done only when it is indicated. Definitely we should go for the simple means wherever possible, because this is the ultimate last or highest mode of treatment, you can say. So next slide. So these are just for your information, like what are the stages of embryos. Like I have told you, it is day 1, day 2, day 3, and ultimately day 5. So that's it. So I think I have a book written for the patients, that is Infertility Solutions. It is available on Amazon, and if anyone interested, they can reach us. So thank you. Any queries if you have from the audience? So I will be happy to answer.
Dr. Richa, thank you very much. This is a fantastic insight for everyone who have not seen the basics as well. So this is fantastic. Conscious of the time, we have only 2 minutes remaining. We would not be able to take any further question because Honorable Consulate General is here. May I request Dr. Rajesh Mishra to say the vote of thanks to all the eminent audience, eminent speaker, and everyone who participated here. Shaji.
Yeah, thank you, Vikram ji. Respected our CG, Mr. John Ralangun sir, Dr. Ishwar Basavareddi sir, Dr. Nidhi, Dr. Richa Sharma ji, and Vikram Rajput ji. Many thanks for your time. As Shaktya is committed to bring everything, every time new things. So I think this is the new topic which we are covering, which people are not comfortable to talk openly. And so this is our way that we present the topics in the friendly environment through the experts. And this is the nice way of the contribution of yoga. As yoga is the part of life, so I'm sure that this yoga will help to bring the yoga and infertility relationship better, and people, the quality of life will be improved. So many thanks to our Consulate General of India, Hamburg, Morarji Desai National Institute of Yoga, Subhag Subhag Tech Healthcare Private Limited, Vikram Rajput ji, and of course Dr. Mishra Academy, and Indian community, Bremen, GINCO, and all other Sabha supporters. Many thanks to all of you who is watching, who is giving time. Thank you very much. Thank you. Namaste.
Thank you, Mishra ji. Thank you very much, everyone. I hope you will enjoy further your evening, and we'll see each other in the next event. Thank you very much. You all have a good evening.
Good night.
Thank you.
Yeah, good
Thank
night.
you all.
Thank you.
Thank you, sir. Thank you.
Thank you.
Namaskar.